facelift. If you want one, if you have questions, this is the video. Hello, I'm Dr. Buğra İPEK. I'm a plastic, reconstructive, and aesthetic surgeon. And today, I'm going to talk about face and neck lifting. I want to go through what I tell my patients during a consultation for face and neck lifting, so you can learn what you got to know before the operation. Face and neck lifting will affect your mid-face, lower face, and neck, which will include all of the neck, your jawline, and your face. What it will not include is around the mouth, upper and lower eyelid, and the temporal region, and your forehead. The nasolabial and marionette lines will also be cleared out. Of course, what I have mentioned that are not included in the operation can be added during the same operation. But let's talk about face and neck lifting alone for today. The operation will take about 3 to 4 hours, depending on the patient. But of course, if you add other things, upper lower blepharoplasty, temporal lift, lip lift, forehead lift, or fat grafting, the time will increase, obviously. Your scar will be in front of your ear and under your chin. These scars are very well hidden right at the edge of the cartilages. Here, I hide the scar right out in front of the ear and at the top of the cartilage, and turning from the earlobe at the back of the ear and through the hairline. And one little scar here to reach down to your neck. Now this one is in a place which is not seen readily. You have to be talking like this to people so that it can be seen. Plus, we usually use the natural crease that you have here under your chin to hide it. The rest of the scars heal extremely well, leaving almost intraceable scars. How is the recovery? Recovery after face and neck lifting will take about a couple of weeks. For the first 48 to 72 hours, you're going to get swollen and bruised. So the swelling and bruising will increase for the first 3 days, and then it will start to dissolve slowly. Compression plus cold compression will help alleviate these. Also, products like arnica cream, hydroid cream, heparin cream, these will also help with these complaints. Lymphatic massages will also help with the discharge of the swelling. Although I have to open a parenthesis here, be careful with the areas of the lymphatic massage, because we also have inner stitches that are delicate, which don't like too much pressure. Also, I usually use a thing called surgical net, which is like a fish net on your face, which attaches the skin to the underlying tissue to prevent bruising and swelling, and also bleeding. When can I return to my normal life after face and neck lift? You can go back to work, your daily routines, usually in 10 days to 2 week period. Although, when will I be photo-worthy? It usually takes about 3 to 4 weeks for that first photo to go on social media or to have a photo without bruises. This can be different for patients, but 1 month photo, 1 month look usually is very acceptable. But of course, a lot of swelling is still remaining there. And you can visualize this, that the first month will be just recovering back to normal. Third month, you'll have the 50-60% of the result, and the 6-month period, you'll have 80-90% result. The end of the year, you'll have your final result. You will have your scars very thin at first, which will then turn red to brown in 3 to 6 months, but then fade away when you finish your first year of healing. Aftercare of face and neck lifting. After the operation, you will have a mask for compression plus drains. The drains usually stay for a couple of days, 2 to 3 days, depending on how much fluid and blood they collect, and we'll take them off, and we'll take off your stitches at that time as well. Of course, not all. Usually the surgical net stitches are taken out at that time. And also at that visit, I'm going to change your dressings to something lighter so that you will feel more comfortable. The first 2 days is going to be a little rough compared to the rest of the healing, but totally acceptable. You will stay in the hospital for 1 or 2 nights, depending on how you do. And then I will see you for your last checkup, usually around your first week, and take the stitches out that needs to be taken. The stitches that are absorbable will be left to dissolve by themselves. What are the different types of face and neck lifting? There are different techniques to face and neck lifting, but the most common ones that are used would be smasplication, smasectomy, or deep plane facelift. Basically, you have SMAS, superficial musculo-aponeurotic system, the layer that holds your muscles. You can think of it as the deeper structure, the beams and rods that hold your face together. When you pull that, you will pull everything. The skin is not the pulling factor. Skin is just the drape. It's just a curtain on what's under lies. And when you pull the SMAS, you're pulling what you want to pull. With smasplication, it's much easier, faster, and you're just folding the tissue on top of it and stitching it so that it forms a rigid structure pulling everything. When we do a smasectomy, we take a piece of the SMAS and then close the gap, pulling the face. With deep plane facelifting, we go underneath the layer, thus we visualize the ligaments, true ligaments that hold the face in its place. And you can actually see this in certain points, that the certain areas of the face will sag, but certain points will not. Now those are the true fixation points, the ligaments lies there. Thus those areas are rigid while the rest sags away. You will open this mass and release those ligaments to have a better pull vector. Plus, with deep plane facelift, you can make an incision, a cut in the SMAS and platysma, the neck and face layers, and pull them in different vectors, different sides, to achieve a better result, to achieve a better jawline, which is one of our aims of this operation. Is there any risk to face and neck lifting? Yes, of course, there's always risk. Never a zero risk operation exists in the world. Is it too much? No. First, there are of course the risk of anesthesia, but usually if you're a healthy adult, this is negligible. The risk of the operations include bleeding, which is 2%. 98% we are safe, but there's always a 2% risk that we might have to do a reoperation to stop the bleeding or evacuate the hematoma. Rare, but can happen. Infection and wound healing problems. Again, these are rare. Face has a very good circulation and heals extremely fast and very resistant. But if you're a smoker, smoking, vaping, all inhalation products and all tobacco products, these are gonna break down your healing and increase all your risk factors. Especially with smokers, we have increased risk for stitches popping up, healing problems, and even skin necrosis, which is basically the skin that we pull dies. Now this is horrible, extremely rare, but can happen, and we usually see this in smokers. If you're a smoker, you should stop before the operation, 1 month before if you can. But smoking after the operation is devastating. That is not acceptable nor negotiable. One risk that we have to talk here is the nerve damage. Your facial nerve goes around and exits your parotid, your salivatory gland, and then goes under the SMAS. Basically, the nerves are like electric cables. They run under the ground, under the muscles, and they connect to the muscles, under the muscles, for almost all, except for a couple of exceptions. Basically, when we raise the SMAS, the nerves are under there. That's how we protect it. We are on top of SMAS, perfectly safe. We go under it, but separating the SMAS from the nerves and pulling it so that your nerves are safe. But still, there can always be a damage. This is a rare risk, devastating one if it happens, but a rare one. One thing though you should be aware is a thing called neuropraxia, when the nerves stop functioning even though the cables are intact. This can happen due to the swelling, bruising, thermal trauma, or blunt trauma during the operation. Now if this happens, this usually returns back to normal in a couple of weeks to a couple of months, can last up to 3 to 6 months. This sometimes we can see, but this usually returns back to normal in a couple of days to a couple of weeks. Of course, this can be scary if this happens to you, but this is just one of the risk factors of the operation. Although these are very rare, you should be aware of all the risks before you go into surgery. How long will my facelift, neck lift last? I like to describe the result lasting time as the natural aging process applies. Basically, we are taking back years. You will look 5, 10, 15 years younger. Perfect, hooray. And you will continue to age. Nobody has a magic wand. You will still age after the operation and continue to age after the operation. 10 years after a facelift, you will look 10 years older. But, of course, on average, I guess you can probably say it will last for 10 to 15 years, depending on the patient. Of course, this applies to your threshold. If you have a very low threshold, and if you won't even tolerate a little sagging, in your mind, when you look at the mirror, you might want to have a revision sooner. What operations can I add to my face and neck lifting operation? Well, as long as your operation time does not exceed a certain time, we can add as many operations as you want. Now, for most operations, for aesthetic and elective operations, I like to stay under 6 hours limit or go above it just a little, not too much. And with the face and neck lifting, it's going to be around 3 to 4 hours. We can add lower and upper blepharoplasty, temporal lifting, fat grafting to face, or lip lift to the operation, or a forehead lift. And depending on you, we can add all or some of it on what you need and what we can fit in during this time. Of course, every patient is different. Some patients' operations just take more time, take more energy, and some just goes easier. Also, do you have any other operations before this one? Is there any revisional aspect to the case? These will increase the time and the challenge of the operation and needs extra and different planning. When can I shower? When can I do sports after a face and neck lifting? Returning back to your normal life. Shower, you will have a shower after I remove the drain. It will be 2 or 3 days after the operation. It's going to be completely safe to operate if everything is normal in that time. And in fact, this is encouraged. Cleaning yourself and keeping a clean body and a clean area is essential to prevent infection. Plus, it's going to be very relaxing after the operation that you just had. Walking. Well, you will walk the night of the operation, and in fact, that's mandatory. And you will be walking regularly after the operation, however you want. But I don't want any activities that will raise your heart rate or your blood pressure, which might increase swelling and bleeding. But you can return to exercise for the sake of exercising, going to the gym, power walking, running, etc., usually around 1 month period. Maybe a light walk can be accepted in 3-week period. This depends on how you do. Swimming. Again, soaking in water. We want to wait at least a month before soaking in the water. Running water is alright after the drains are out, but I don't want that at that point. The complete healing process should be stopped for the scars to be safely soaking in water, and usually 3 to 4 weeks is that time. Can I drink alcohol after face and neck lifting? First, after the operation, you're going to have swelling, bruising, and alcohol is going to increase that swelling. So we don't want them together. Plus, you will be taking medications which can interact with the alcohol. So until those are finished, you're not allowed to consume any. And for the first month, it's better to avoid alcohol to avoid extra swelling, unnecessary swelling. But after a month, social drinking is acceptable. Tea, coffee, you can have after a couple of days, 1 or 2 cups a day. That is all right. But herbal teas, usually not recommended due to some mixes can increase bleeding tendencies and should be waited and should be used at least after a week. Thank you. I'm Dr. Buğra İPEK, plastic and reconstructive and aesthetic surgeon, and if you have any questions, just write to us.